Hello, everyone. Bonjour à tous. Kwe Kikina. This virtual press conference is being held in Ottawa on Friday, May 22nd. I'm the moderator, Greg Quinn, with Market News International. With us today, we have Canada's Chief Public Health Officer, Dr. Joss Reimer, to provide updates about hantavirus and Ebola. We also have representatives from Global Affairs Canada and the Border Services Agency. If I could ask those officials to identify themselves before speaking for the journalists watching this presser. I would also note, before guests deliver opening remarks, kind of a safety announcement for our translators. I remind everyone dialed in to stick to best practices, such as using the proper equipment and minimizing outside noise. And for those online, please use the raise hand function to signal you'd like to ask a question. And with that, Dr. Reimer, please go ahead.
Thank you so much, and thank you everyone for joining us today. Before we begin, I want to acknowledge that we are gathered on the unceded traditional territory of the Anishinaabe Algonquin Nation, and I would like to take a moment to reflect on the history of Indigenous people and honor the original stewards of the lands where we live and work. So I will begin today with an update on the Ebola situation in Africa and what it means for Canada, and then I will provide an update on the Andes hantavirus. So on May 15th, Africa's Centers for Disease Control and Prevention declared an outbreak of Ebola disease in the Eastern Democratic Republic of Congo. Cases linked to this outbreak have also been reported in Uganda, including an imported strain that was confirmed to be the Bundibugyo virus strain. On May 17th, the Director General of the World Health Organization declared this outbreak a public health emergency of international concern due to the evidence of cross-border spread, uncertainty around the true size of the outbreak, the potential for wider regional and global impacts, and the need for global collaboration. It's important to be clear that while this is a serious and evolving situation, cases remain localized and the global risk is low. Cette éclosion se trouve dans une région confrontée à des défis complexes, notamment la proximité des centres urbains, des problèmes de sécurité et des niveaux élevés de mouvements de population liés à l'activité minière. Ces facteurs peuvent accroître le risque de propagation aux échelles locales et internationales. Nous reconnaissons que le risque pour les personnes vivant dans les régions concernées est élevé et nos pensées vont aux personnes, aux familles, aux communautés et aux professionnels de la santé qui subissent directement les conséquences de cette éclosion complexe. Le Canada est prêt à apporter son aide. Based on the Public Health Agency of Canada's rapid risk assessment and in alignment with the World Health Organization, the risk to people in Canada is considered to be low at this time. There has never been a case of Ebola disease imported into Canada despite numerous Ebola outbreaks in the affected region. I do, however, want to be transparent that out of an abundance of caution, one individual in Ontario underwent precautionary testing. This individual recently returned from Ethiopia and reported symptoms that were consistent with a range of illnesses. Both the initial testing that was conducted in Ontario as well as confirmatory testing at the National Microbiology Laboratory were negative. So this is a good example of how quickly measures are activated, even when the likelihood of Ebola here in Canada is low. Ebola disease is transmitted through direct contact with the body fluids of an infected individual who is showing symptoms, or through contact with infected animals or contaminated materials. It is not spread through casual contact, and it does not spread through the air like respiratory viruses. Those at highest risk are individuals providing care to patients with Ebola disease, those participating in burial practices involving direct contact, or those working in healthcare or laboratory settings where the virus is present. Bien que le risque au Canada reste faible, nous prenons cette situation très au sérieux et adoptons une approche de précaution. L'Agence de la santé publique du Canada surveille activement l'éclosion en étroite collaboration avec ses partenaires internationaux, notamment l'Organisation mondiale de la santé, ainsi qu'avec les autorités de santé publique provinciales et territoriales. À nos frontières, nous avons renforcé les mesures de dépistage. Depuis le 20 mai, des questions de dépistage approfondies sont posées aux kiosques des aéroports aux voyageurs qui se sont rendus en République démocratique du Congo ou en Ouganda au cours de les 21 derniers jours. On demande désormais aux voyageurs qui se sont rendus dans ces pays s'ils présentent des symptômes ou s'ils ont pu être en contact avec une personne atteinte de la maladie Ebola. Nous avons également déployé des agents supplémentaires chargés de la quarantaine et du dépistage dans les principaux aéroports. Et nous avons maintenant un système de surveillance centralisé fonctionnant 24 heures sur 24, 7 jours sur 7. Des affiches ont été installées dans les principaux aéroports du pays, informant les voyageurs sur les procédures à suivre s'ils ne se sentent pas bien. Ces mesures s'appuient sur la loi sur la mise en quarantaine et visent à détecter rapidement les risques potentiels et à garantir que les mesures de suivi appropriées soient prises. On Wednesday, a flight was redirected to Montreal due to a passenger of concern. FAC quarantine officers assessed the individual, determined they were asymptomatic, and appropriate border procedures were followed. For travelers, I want to emphasize the importance of checking the Government of Canada's travel advice and advisories before departure. Individuals returning from affected regions should monitor their health for 21 days. If symptoms develop, it is critical that they isolate immediately, away from others, and contact local public health authorities before seeking in-person care. Le Canada dispose des solides systèmes de laboratoire et de surveillance. Tout cas suspect au Canada serait immédiatement signalé et des échantillons seraient envoyés au laboratoire national de microbiologie de Winnipeg pour des tests de confirmation. Les résultats sont généralement disponibles dans les 24 heures suivant l'arrivée des échantillons au laboratoire. Notre laboratoire national de microbiologie continue de jouer un rôle de premier plan à l'échelle mondiale dans la recherche sur le virus Ebola, notamment dans le domaine des vaccins, des traitements et des diagnostics. Les scientifiques canadiens ont joué un rôle déterminant dans la mise au point de premiers vaccins contre le virus Ebola au monde. Et ils continuent de contribuer aux efforts de préparation et d'intervention à l'échelle internationale. This outbreak underscores the importance of global collaboration. Canada continues to work closely with international partners through established mechanisms such as the World Health Organization and the Global Outbreak Alert and Response Network. We stand ready to provide technical expertise and support if requested, as we have done in previous outbreaks. Our shared goal is to contain this outbreak at its source and reduce the further spread. I will now turn briefly to the situation regarding Andes hantavirus. So Canada has confirmed a case of Andes hantavirus linked to the MV Hondius cruise ship earlier this month. At this time, there have been no additional cases identified in Canada beyond the initial confirmed case in British Columbia, and all high-risk contacts continue to be monitored by local public health authorities. The overall risk to the general population in Canada remains low at this time. Nous continuons d'adopter une approche de précaution compte tenu de la gravité de ce virus, tout en reconnaissant que la transmission interhumaine de antivirus entre est rare et nécessite généralement un contact étroit et prolongé avec une personne présentant des symptômes. Nos pensées vont à la personne hospitalisée en Colombie-Britannique et à sa famille. Nous remercions nos collègues de la santé publique ainsi que l'équipe soignante pour l'excellente prise en charge et le soutien qu'ils lui apportent. Cette semaine, j'ai eu l'occasion d'assister à l'Assemblée mondiale de la santé à Genève, où j'ai rencontré plusieurs de mes homologues internationaux afin de discuter des défis de santé publique auxquels nous sommes tous confrontés. J'ai également rencontré le Dr Ghebreyesus, directeur général de l'Organisation mondiale de la santé, ainsi que des membres de son équipe de direction qui dirigent les interventions d'urgence, notamment la réponse à la maladie Ebola en RDC. Ces discussions ont réaffirmé l'importance de la transparence, de la communication rapide, de l'information et de la coordination pour répondre efficacement aux menaces émergentes en matière de santé publique. Les événements de ces dernières semaines ont démontré que des relations internationales solides ne sont pas seulement précieuses, elles sont essentielles. So in conclusion, we have a robust system in place for detection, prevention, and response. We are working in close collaboration with provincial and territorial partners, as well as with international organizations and governments to ensure a coordinated and effective approach. We will continue to provide timely updates and clear guidance as new information becomes available. I want to send out a special thank you to our public health partners across the country, our frontline healthcare workers, lab scientists, and our international colleagues for their dedication, their expertise, and collaboration. Together, we are working to protect the health and safety of people both in Canada and around the world. Thank you. Merci, miigwech.
Thank you. I believe now we will take some questions. I believe we might have until 1:45 p.m. or so. So let's stick to one question, one follow-up. Une question, une supplémentaire. Et premièrement, je vous Annie Guillemette Kojiko. Vas-y.
Bonjour. J'aimerais savoir, à l'aéroport, depuis que vous posez des questions aux gens qui arrivent du Congo ou de l'Ouganda, il y a combien de personnes à qui on a demandé de surveiller leurs symptômes depuis 21 jours et qui sont donc en état de, je ne sais pas comment on les appelle, de surveillance là, présentement?
C'est une question pour pour Andrew Lawrence.
Oh, je ne fais pas le choix sur la personne qui va répondre. Je n'ai pas aucune préférence.
Maintenant, on n'a pas à voir des voyageurs qui ont affaire à l'Agence de la santé publique.
Donc, jusqu'à maintenant, il n'y a personne qui a été référé à la santé publique pour cette surveillance-là. C'est bien ça que je comprends?
Je ne peux pas entendu la question.
Ah, ben, il n'y a pas de problème, je vais la répéter. Je voulais savoir depuis le début du processus de questionnaire à l'aéroport pour les gens qui sont en provenance des pays touchés, le nombre de personnes à qui on a demandé de surveiller leurs symptômes et qui sont donc considérés là, comme en surveillance depuis le 20 mai. Ça fait 2 jours là, que c'est commencé.
Je ne peux pas entendre la question en ligne.
Je sais. Est-ce que le modérateur m'entend?
Oui, bien sûr. Mais essayez encore, et peut-être
OK. Parce que là,
plus de
moi,
succès.
je module dans l'audio. Je ne sais pas trop. Est-ce que vous m'entendez, monsieur des Borders?
Non,
Vous m'entendez
le
bien?
volume ajuste, mais on peut répondre aux questions après la téléconférence.
Ah,
Ouais.
OK. Merci.
D'accord. So we will switch on. Apologize for that technical problem. We'll try Hannah Alberga, Canadian Press. He may have dropped off. All right, as a stopgap, I propose turning to Jennifer Lagrassa, CBC News.
Hi there. Thanks so much for taking our questions today. I'm just wondering, I just want to make sure I've got this right. So the person who was on that flight and who landed in Montreal Wednesday, were they actually tested for Ebola or they were just screened for symptoms?
I can take that question. So the individual, the flight was redirected to Montreal because there was an individual on there who was from or had traveled to a potentially affected region. They were assessed by a Public Health Agency of Canada quarantine officer, found not to have any symptoms, and have since returned to their point of origin.
Okay, thank you. And just another question. Canadians are asking why Canada hasn't instituted a travel ban, especially when we're seeing the restrictions that are in place in the United States. Can you explain some of the reasoning behind that decision?
Yeah, so a decision around the borders is a decision that is made by Cabinet. However, I will be providing advice to Cabinet on this very fluid, rapidly evolving situation with information that we get from the World Health Organization, from Africa CDC, and make sure that the decision makers have all of the up-to-date information as they make this difficult decision.
Merci.
Thank you.
Et maintenant, Aimé Lemieux, Radio-Canada.
Oui, bonjour, est-ce que vous m'entendez?
Oui.
Oui, j'ai essentiellement la même question en français. Considérant que les États-Unis ont resserré leurs règles d'entrée, les règles aux frontières de façon assez sérieuse, est-ce que c'est envisagé aussi ici?
Est-ce que vous pouvez répéter la question? Malheureusement, il n'y a pas interprétation.
Oui, ma question, c'est de savoir, est-ce que de resserrer les règles d'entrée pour les voyageurs comme l'ont fait les États-Unis dernièrement, est-ce que c'est envisagé au Canada aussi?
La décision de mettre en place les border measures, les mesures de frontières, il reste avec le cabinet des ministres, mais c'est important que je les donne les bons conseils qui va changer avec l'information, qui va changer tous les jours. Mais je suis en train de travailler avec mes collègues à l'Organisation de santé mondiale et de l'Africa CDC pour donner le meilleur conseil au cabinet des ministres.
Peut-être une sous-question. Qu'est-ce qui pourrait faire en sorte qu'on resserre les règles aux frontières? Quelles conditions doivent être réunies pour qu'on fasse comme les États-Unis, par exemple?
C'est important que le cabinet de ministres, ils ont le bonne information et c'est quelque chose qui va changer avec une situation qui change très vite. Aujourd'hui, c'est pas possible de dire exactement ce qui va changer de jour à jour, mais c'est important que je continue de travailler avec mes collègues à l'Organisation de santé mondiale pour donner l'information actuelle au cabinet des ministres.
All right, thank you. We will now turn to, I believe it's Crystal Dabu, Bell Media. Please go ahead.
Sorry, can you hear me?
Yes, go ahead.
Okay, great. Thanks for your time. I would like to know why Canada had to accept the flight that was diverted from the US due to that passenger who was from the Democratic Republic of Congo. I just want to understand like how the decision making works on whether to accept that diverted flights, and in this case, yeah, with the passenger from the epicenter of the Ebola outbreak.
I would have to defer to my colleagues at Transport Canada or perhaps CBSA, but I believe Transport Canada because those discussions do not fall within the Public Health Agency of Canada's purview.
Okay, and how about, sorry, can I ask a follow-up?
Yes, of course. One follow-up, yes.
Okay. Does Canada need to put in travel restrictions related to the infectious diseases like Ebola?
Travel restrictions are one of many tools that we have available to protect Canadians and respond to outbreaks around the world. We are doing many different things right now, including enhanced screening at our borders. We are partnering with the World Health Organization as well as with Africa CDC to make sure that we have approaches that are based on up-to-date information, based on evidence-based information. And so we want to make sure that we are contributing to the response on the ground to help control the outbreak where it's occurring, as well as having appropriate measures in place so that should anybody come to Canada, that we are ready with our enhanced screening and that all of our sites across the country are prepared for, should there ever be presentation of a case or even possible case, that they have all of the measures in place to be able to respond safely and protect Canadians and healthcare workers, as well as the individuals who are requiring assistance.
Okay, thank you.
Thank you. We now have Christy Kirkup, the Globe and Mail. Please go ahead.
Hello, can you hear me?
Yes, go ahead.
Great. Thank you. Thank you, Dr. Reimer. I'm wondering, you talked about enhanced screening at the border. Can you detail what those enhanced screening measures are and when they came into effect?
Yeah, perhaps I can start, and then I don't know if CBSA may want to add any additional details. So we have added additional screening questions on entry to the country, which, as I've just returned from Switzerland, I can personally attest that I was asked additional questions regarding whether I had traveled to the area, whether I had any symptoms that could be related to Ebola. So that is something that is occurring. We've also brought additional staff into our most common ports of entry so that we do have quarantine officers, as well as other appropriate staff available to manage should anybody come to the border and demonstrate any risk factors that we would want to have more closely assessed. But I will turn over to CBSA so they can potentially provide any additional details.
Well, thank you. So, yeah, we have enhanced our questioning at the primary inspection kiosk and across some applications. And just a reminder, our officers are designated as screening officers under the Quarantine Act and are well trained in the event that a traveler displays any symptoms of illness. Thank you.
I'm just wondering, as a follow-up, when did these measures come into effect? I've just been covering this closely, so this is news. So I'm just wondering, when did this kick in?
I can take that. The enhanced questioning at the ports of entry kicked in on May 20th.
Thank you.
All right. I believe Hannah Alberga from Canadian Press is back. Please go ahead.
Yeah, can you hear me this time?
Yes, absolutely.
Can you hear me this time?
Yes, we can hear you.
Okay, wonderful. Sorry about that, and thank you so much for this update. Dr. Reimer, I just wanted to ask, you mentioned that you're going to be giving advice to your colleagues next week. You know, what would it take for you to recommend a travel ban at this point in time?
Yeah, so there's a number of issues that are changing rapidly as we learn more about this outbreak. And so it's important that we look at how effective things like travel bans are. We need to be looking at whether or not there is any evidence that the outbreak is escaping the area that it's currently concentrated. We also need to be looking at things like how the virus is spread. I want to really highlight that Ebola is very different than respiratory viruses like COVID. The way that it's spread is from much closer and prolonged contact. And so we do need to manage this virus differently than how we did with things like COVID or influenza or measles. And so there's a lot of different factors that we need to be partnering with the World Health Organization, with Africa CDC, and with other countries around the world in providing the best advice we can to our decision makers so that they can make decisions about border control measures.
And how common is it to test travelers from Africa for Ebola? Like, will this become more common practice now that the outbreak is spreading? It's been considered high risk, as you said. Are you currently testing other people apart from that one person from Ontario for Ebola in Canada?
So testing for Ebola would only be for people who are presenting symptoms that could be consistent with Ebola, as well as an exposure that would put them at risk for Ebola. So for example, someone who has no travel history, no exposure to any other people who are ill with Ebola would not necessarily be tested for Ebola if their risk of being exposed to that virus were negligible. So the individual in Ontario was out of an abundance of precaution because they did have travel to Ethiopia and may have had some exposures there that was individually assessed by their clinician in Ontario, as well as with Ontario public health officials when that decision was made. So we're not testing all people who have traveled to areas where there may be Ebola, but rather testing is reserved for those people who have symptoms. One of the helpful things about Ebola is that it is transmitted only by people who are showing symptoms or by contaminated objects or samples. And so that is something that we are able to reserve for people who are presenting with symptoms.
Possible de répéter en français cette réponse-là, s'il vous plaît?
Pour la décision de donner un test Ebola à quelqu'un, c'est important qu'ils ont des symptômes. C'est pas possible de transmettre le virus d'Ebola, sauf si la personne a des symptômes. Alors, c'est un test qu'on va donner à quelqu'un qui a deux choses. Les symptômes qui peut être Ebola. Et aussi, la deuxième chose, c'est une manière dont il peut être exposé, non, c'est pas le même, transmettre le virus. Pour exemple, quelqu'un qui a voyagé à un pays avec Ebola et aussi s'il a des symptômes, ça c'est une situation où où on peut donner le test pour vérifier si c'est le Ebola ou non.
Merci.
Greg, are you still there? If so, you're muted. This is Jean-François from the press gallery. I'm trying to reach Greg. I don't know what's is going on. I don't know if Christy or Hannah, you both had your hands up. I don't know if you still had questions. Hannah, I think we just went to a question from you. So how about Christy? Kirkup from the Globe and Mail.
No, I'm good. Thank you.
Thank you. All right, so Greg is saying he's speaking, but we're not hearing him, so we can figure this out later. But I don't see any other questions in the room right now. So unless anybody else has any last-minute questions, we can end this tech briefing. Thank you very much. Merci beaucoup pour votre temps.